Hello everyone and welcome back to my channel. It's so good to be able to come back and do a few more videos for you guys. I've been busy but finally here now, and let's get into it. So today I'm going to talk about activities of daily living. So obviously there is a few of them. They're long. It's 12 activities of daily living. I'm not going to go through all of them today. I'm going to do a part 1 and a part 2 to this, just to kind of like make sure I have enough time to explain different things to help out all the student nurses out there, because I know how it's like to be a student nurse with lectures, assignments, placement, the whole lot. But you can get through it. Others got through it. You can get through it. So let's get into it. What are activities of daily living? So activities of daily living are basically the activities that a person does to maintain a relatively good lifestyle. So there are 12 activities of daily living. You're going to learn this possibly in your first year as a student nurse, and it's sometimes referred to as the Roper Login model. So it's maintaining a safe environment, communication, breathing, elimination, controlling body temperature, personal cleaning, hygiene, mobilizing, working, leisure, sleeping, expressing sexuality, psychological care, and etc. So that is all the 12 activities of daily living. Now you don't have to know all of them, but you just have to know a little bit about each one. So we're gonna get into it. The first is maintaining a safe environment. So patient safety is our priority. Why is this? Any of you who have been on placement, you know when you walk into a room, a ward, and you've got your 6 patients or 4 patients depending on the setting of the room, sometimes first thing in the morning or in the rush hour, busy hours of the morning, you can have commodes everywhere, IV stands everywhere, chairs stacked on top of each other. You could have all sorts of things, so busy, hoists in the middle, and that is not a safe environment for our patients. We want to create a safe environment. That environment is prone to patient probably tripping over something and falling. So we want to make sure we create a healthy and safe environment for our patients. Also, when patients come up from A&E and they're being admitted to your ward, you want to give them the call bell. A bell for them to ring when they need a care assistant, or they need a nurse, or they need any sort of assistant, because in the busy environment clinical setting, you're not going to always know that that patient needs this, that patient needs that. But if that call bell is there and a patient is cognitive enough to know to ring it, it'll save you a lot. All patients who are at risk of falls. So different hospitals have like different strategies that they put in place to prevent falls, so you can have, they might have a wristband that shows that they're high risk of falls. They may have socks that are a certain color to alert people that that's patient who's at risk of falls, and usually those socks have an anti-slippery grip on them, but essentially you want to make sure patients have their own footwear, that every time they're going anywhere to the bathroom or to get an x-ray done, that they put on the appropriate footwear that is going to prevent them having falls. Ensure patients have appropriate aids, walking frames. Some patients have their own frames, the rollator frame, but if not, then by all means ask maybe the physiotherapist who can provide one for that patient, just to help them in their mobility to the bathroom. Communication. So communication is so important. I'm sure as a student nurse you're going to have some sort of assignment which is going to require you to either talk about communication, demonstrate effective communication, or look at the different aspects or the different studies about communication, how how it's important to have effective communication in anything, in any workplace, especially in the clinical setting. You want to be able to communicate effectively with your patients. You want to be able to communicate effectively with the multidisciplinary team, with the doctor, with the physiotherapist, anybody, your co-workers. So always introduce yourself, you know, tell the patient what your name is, what your role is, and can I help you? You know, it's always nice to be able to say that, you know, to introduce yourself, because oftentimes patients haven't got a clue who their nurse is, who their care assistant is, and who their doctor is. They haven't got a slightest clue in the world. And that is our fault as healthcare professionals. We should be able to introduce ourselves to the patient. So there's a doctor in the past, Dr. Kate Granger, who started the Hello My Name Is campaign. She was with cancer and she was terminally ill, and one thing that she found was that a lot of the healthcare professionals that came to her, they didn't introduce themselves to her. She didn't have a clue what their names were, and so she started this campaign for people to introduce themselves. They say to say hello my name is. So some hospitals have hashtag hello my name is badges to help patients know who you are, and not just patients, everyone else gets to know who you are. So it's a really great way for us as healthcare professionals to communicate that our name, just tell the patient our name. Another thing, we want to avoid using medical jargon. Now it's super hard to do that, because it's so easy to just be like, oh, I need a chest x-ray, I need a CT scan, I need the U-score is this. It's very difficult for us to actually step back away from that type of language and to use a language that is more generally understood by anybody, that you don't have to be in the medical profession to understand the meaning of those words. It just helps the patients to know what their condition is, what their problem is, what the plan is for them, and without them just scratching their heads and going like, what is she talking about? What? Who? And sometimes they're just so embarrassed to tell us, to ask us what that means. And oftentimes as a nurse, you'll find that the doctors will come on their rounds, they'll tell the patient, okay, this is the plan we have for you, this is what happened, and this is where we see things going. And the patient will just nod away, and by the time the doctor is gone, and maybe you just didn't have a chance to step in and listen in, the patient will ask you, nurse, what did the doctor say? What was, I didn't understand anything. Like a really good example of how like obviously doctors should also speak to patients in a way that they can understand, just to help, you know, with communication. Verbal consent should be gained every time before, you know, carrying out any activities of daily living. You want to explain what you want to do and gain consent from your patient. So the last thing we want to talk about is breathing. Because there's so many different types of activities of daily living, I'm not going to go through every one, as I've already said. I'll touch more on the other activities of daily living in part 2 of activities of daily living videos that I want to do. So the next one is breathing. So ensuring patients are sitting upright. You know, oftentimes patients are just sluggish, like they're just slug in the bed. No matter how many times you push, like you help them to sit up, they always lie down. So you want to just make sure that they're sitting up, especially if they've got, you know, breathing difficulties. If they're about to eat, you want them to sit up and, you know, relatively comfortable, sit upright, pillows on the back, and yeah, check the face, nose, around their nose, nasal prongs, masks for redness. So oftentimes patients are on oxygen, they've got the little nasal prongs all around their ears, and you just want to make sure that there's no cuts around the ear or around their nose and around their ear, and sometimes they have their masks. So oftentimes you see that in patients who are on a respiratory ward and they have to wear their non-invasive ventilators, so the BiPAPs or CPAPs. So because they have it on for like quite some time, like they could develop some pressure sores here. So it's important to check for that. And very commonly around the ear, I recently had a patient who had a sore on his ear, and I didn't understand. He kept on saying, "Nurse, I've got a sore on my ear." And then when I actually looked that day, I found it was a proper pressure sore just from nasal prongs, because I couldn't understand where else he would have gotten it from. So it's just really important to look at those areas and to, you know, prevent that. One little trick that I use, I just get a piece of gauze and I tape that gauze around the nasal prongs on the ear, and that kind of like helps alleviate the pressure on the ear for the patient. If patients are on oxygen, check with the staff. If you're a care assistant or you're a student nurse and the patient, say, wants to go to the bathroom, just ask, do they need oxygen going to the bathroom? Because patients, obviously, if they're on oxygen sitting in the bed, in the chair or in the bed, most likely they're gonna need oxygen going to the bathroom. Sometimes they're okay, they can manage, but what is tricky is when patients are not on oxygen, but they require oxygen when they're walking. They're not on oxygen when they're in the bed, but if they're walking to the bathroom, they need oxygen. So always check with the nurse and find out, do they need oxygen? Do they not? It's better to be safe than sorry, because the minute you walk with a patient, they're like out of breath in the start, that, you know, you don't want them to be cyanotic. You don't want them to have a respiratory arrest. You want to prevent any harm to your patient by being diligent and finding out in advance. So check for patients' fingers and lips. They may become cyanotic. Look for areas like that, because, you know, patients, as care assistants or as student nurses, you might see something that we might not see, because maybe we might just be occupied with something else. But if you notice that a patient's fingers or noses are a bit cyanotic, you want to just find out, let us know. They might be becoming hypoxic and might need some oxygen in that case. So that is all for this video. Next time I'm going to talk about eating and drinking, elimination, controlling body temperature, personal cleansing. It'll be a part 2 to this, so you don't want to miss it. If you're a student nurse, this is really helpful information that can help you and in your placements or with your assignments, you know, to complement with your obviously your lectures and your textbooks and your articles, or anything that you're going to use to help with your exam questions, etc. So that is all for today's video. I hope you enjoyed it. All the student nurses out there who have maybe exams coming up or assignments, just stick at it. It may be hard. It may be like, oh my goodness, why do I have to do all of this? It's so much work. But keep at it. Stay focused and you can do it. Okay? Until next time. Bye.